forward. And I just wanted to say a couple of things. First of all, you will see in the presentation tonight, if you've seen other presentations of this plan or if you've seen it on the website, that there are some modifications in what we're presenting. And I think that demonstrates that we're listening to the various groups that we're meeting with. And I'll explain those as I go through these slides. But I think it's important that we hear from you. This is far from a final plan. We're not locked in on anything. If anything, I think we recognize now that we need to slow this process down a little bit and get some additional input and look at some of these concepts in the plan a little bit deeper before we consider final approval of this plan. This slide just shows the initial round of town hall meetings that we had in the summer. 7 town hall meetings to receive initial input from the public, and I'm going to talk a little bit, as Chairman Batts did, about that input. Some of the core themes of this plan and what we're really trying to address in this plan. As we look at this plan, we want our services to be convenient, accessible to our patient population, provide the services in certainly a caring atmosphere, provide a more comprehensive set of services for our patients, and be responsive to patient needs with the focus on high-quality patient care. This slide kind of summarizes the entire plan, but it's hard to read, so I want to break it into some of the major components. The mission of our county health system has not changed. We're here to care and advocate for the poor and the underserved of Cook County, and that is still the guiding principle of our organization and this plan. We have spent a lot of time on the vision statement, and I'm going to read it because I think it's important and it really guides the plan. In support of its public health mission, the Cook County Health and Hospital System will be recognized locally, regionally, and nationally, and by patients and employees as a progressively evolving model for an accessible, integrated, patient-centered, and fiscally responsible healthcare system focused on assuring high-quality care and improving the health of the residents of Cook County. Now, there's a lot of words to that statement, but we feel it's important and that it really sets the tone for this plan. There's 5 core goals that comprise the plan. Number 1 is access to healthcare services, and I think this is the biggest issue that we've heard and that we're trying to address in this plan as we look at how we organize our healthcare services for Cook County. And what we're recommending is a major change and to help us address accessibility to our services. Right now, we've got 3 hospitals, we've got 16 ambulatory clinics spread throughout the county. We have the Core Center, which is close to the Strozier campus, and of course, Cermak Health Services at the county jail. We recognize that we need to be more accessible. So what is recommended in the plan is that we consider developing geographically distributed regional healthcare centers that we, in the plan, they're called hubs, but essentially they're very robust outpatient centers that would provide many of the services that people have to travel to the Strozier campus, the Fannis or Strozier for, could be provided in these regional hubs. And we feel that that is a more accessible approach to providing care to our patient population. In addition, the second issue related to access, The first is geographic access. The second is our own processes and systems within our health system that make it difficult for people to schedule, to get appointments. We've heard a lot about the long waits for procedures, for being seen, the scheduling system problems. So we need to fix those issues as well, not just be more geographically accessible, but address some of our internal issues, and we're committed to doing that. I'd like to describe what our concept of a hub would look like, and this chart here provides an overview of what a hub could look like, and not necessarily all of these services being provided in all of these regional centers, but just to demonstrate that this is really more comprehensive than an outpatient or typical outpatient ambulatory clinics. So in addition to primary care, outpatient, and specialty care, we'd be also looking at providing outpatient surgery, urgent care. Many of our patients that come to our emergency rooms are not necessarily emergent patients, so to be able to treat those patients in a better environment, possibly observation units for patients that have had procedures, preventative health, health education. And as Chairman Batts indicated, there's a great need for dental health, mental health. So to be able to provide these services within these regional centers. And not necessarily that the county, would provide all of these services, but if we can develop relationships with other providers that could provide, some of these services with us in these regional centers. In addition, many of the services where we know that there's accessibility issues, procedures like colonoscopies, endoscopies, mammographies, could also be provided in these centers. And also extending our HIV services. And I know we have done that to some extent, but we feel that there's an opportunity to extend those services even more through these regional centers. So as we look at our strategic plan, and if this concept of developing these regional centers is adopted in the plan, what we would do is take a look at our locations in the county, which is what this map illustrates, but then to really zero in a little bit deeper on where other providers are providing services and where we should be locating our services to best meet the needs of the population of the county. And I thought we had a map of this particular area to show. We don't have it on here, but what we're doing is looking at each sub-region of the county and looking at not just where we have our services, but also other providers, to identify where these areas of need would be, where we could consider locating these regional centers. The other thing I wanted to say about this, because there was some confusion in some other meetings, would we be closing our clinics as a result of developing these regional centers? And this question came up last night in Austin. That, the question was, would we be closing the Austin clinic? And the answer is no. We'd be looking at these regional hubs in addition to our outpatient centers. In some areas, depending on where the regional hub is, we could co-locate our outpatient ambulatory clinics with the hubs. But developing these hubs does not translate into closing our ambulatory clinics. The second goal addresses our program strengths. And what are the services, our centers of excellence, or those services that we excel in providing, that we want to continue to invest in to care for the patients of the county? And certainly at Stroger Hospital, Our trauma center, our burn center are recognized nationally at the Chorus Center and throughout the health system. Our HIV services, being the third largest public health system in the country, we're certainly dedicated to providing cancer, cardiac services,